Are you low-key confused about why you've been feeling burned out and why some communities feel that emotional burden more than other communities? Well, you're in luck. We are here with Dr. James Garcia from the Department of Psychology, who studies this topic and is going to help us make it make sense. Dr. Garcia, let's start with some of the basics. How does stress impact health?
Yeah, thank you, Dean Stern, and I'm really excited to be here in Loki Confused. So typically, how health has been kind of conceptualized has been from a biological, psychological, and social kind of framework. The World Health Organization has been very key in making sure that it's more of a holistic view of health. And so when we talk about stress, it affects us in those three areas. So biologically, how does that work? Stress hormones, right? Things like cortisol, things like glucocorticoids, which is just a fancy term for like stress hormones. Our nervous system gets affected. The fight, flight, or freeze response sometimes that we have also is kind of dictated by our nervous system here. Brain regions light up or don't light up as well. We have our biological system of the heart also working, our lungs, and all these things that go into disarray and overdrive. And so biologically, we like being stable and not too much of anything, right? And so when we are in that unbalanced state biologically, that's when stress really gets under our skin, as I like to put it.
Oh, that hurts. Yeah.
Yeah, so that's biologically, psychologically, right? We might feel tension, headaches. We might feel depressed, anxious, stressed. We might feel hostile towards people. We might even dissociate and not be present.
Yeah.
And then socially, we might not engage with our friends. We might not engage with our family, our loved ones. We might not go on outings with people.
Yeah.
There's also behaviors, because it's also part of the mix here. So things like eating more, drinking more, using drugs to numb yourself out under times of stress, maybe engaging in risky sex as well. So it's not just all one thing, it's a combination of all these things.
Yeah. One thing you study, as represented by the book that you have published, Heart, Brain, and Mental Health Disparities for LGBTQ People of Color, is the fact that stress does not hit all communities or individuals of all communities in the same way. So can you talk about some of the unique, like, psychosocial stressors that marginalized folks in the US may feel more prominently?
Yeah. Definitely. So Americans just in general we're all stressed out. Things like, the future of our country, economics, healthcare, all these things that really the American Psychological Association has found have been the leading causes of stress for Americans. I think 7 out of 10 adults report that the future of the nation is something that they worry about and are stressed out about.
Yeah.
There's a couple of other ones, like politics coming in at 6 out of 10, and then I think healthcare at 5 out of 10 people.
This is a recent survey.
This is in 2024.
2024 survey.
So
Yeah.
They might come up with the 2025 survey later on this year.
Yeah.
But the burden of stress is not the same for everybody. When we look at segments of the population, so for example, people of color, communities of color, 4 out of 10 Latinx people report that politics have caused like a strain with their family, and that stresses them out. 4 out of 10 LGBTQI plus persons kind of report the same thing too. Underlying, I think, a lot of these differences in terms of what is stressful is the idea that people are treated differently, discrimination, right? And so racial ethnic discrimination, that report also studied that, focused on that.
Yeah.
And they found that 7 out of 10 adults reported having these forms of discrimination where they're treated differently based on the way that they look, or being unfairly stopped, searched, and questioned. 24% of LGBTQ plus persons reported having these forms of discrimination as well.
Mm-hmm.
And when we look at if stress is also attributed here to these experiences, Latino, Latinx persons reported more stress compared to white or Black persons in that survey.
Mm-hmm.
Same thing with LGBTQ plus persons. They also reported more stress from these experiences.
Yeah. Yeah. And that's in maybe the best of times. This
Mm-hmm.
time, it feels unprecedented to a lot of folks. So when you look around at the world right now, what are there places that you are worried, or things that you're worried about maybe causing even more stress on top of that, and how might that manifest?
Oh, yeah, there's definitely a lot going on. I think if we take a bird's eye view perspective, political rhetoric definitely is hurting communities. It's making divisions that were there before very very obvious now.
Yeah.
Us versus them type of mentality that serves to exclude people, right? Policies like the Department of Homeland Security being able to racially profile
Yeah.
certain communities based on language and ethnicity and all these other factors.
Mm-hmm.
Laws that are enacted, like the banning of LGBTQ plus books. Like my book would be banned in Florida.
Oh my goodness.
It wouldn't exist over there.
Yeah.
Rolling back protections for trans and non-binary folks, right? There are laws in this country that do not give them protections. There are 17 policies in states that actually harm trans and non-binary people. The Movement Advancement Project usually tracks these. So does the Human Rights Campaign.
Yeah.
And that's as of now in 2025.
Yeah.
So definitely those two. The economy, there's always uncertainty about the economy. Whether we're going to tip into a recession with the jobs report and all this stuff coming out.
Mm-hmm.
Access to healthcare. So that is now becoming an issue, especially for like rural communities, right? Where federal funding is being pulled away from these communities, unfortunately. And also, not only is it an access issue, but for those of us that do have access, right? Maybe low quality healthcare. Oftentimes, when we go to the doctor, sometimes we might feel like we're like a number.
Yeah.
And that's the low quality aspect where your healthcare provider isn't really understanding what you attribute your illness to be,
Yeah.
and what you think is contributing to why you got diabetes.
Yeah.
So that's definitely up there. And so ultimately, these cause health disparities, and these are differences in health, right? But these differences are due to these economic, social, structural factors that create these differences.
Yeah.
Yeah.
You have kindly invited me into your health disparities classroom, right? So I've gotten to see some of the presentations that your students do. So just to underline this, because you've been tracking and studying health disparities for most of your career, and now it feels like as the healthcare system gets even more stretched, that you anticipate seeing even more of these disparities.
Definitely. We just recently were able to close like the disparities in heart disease for certain groups, like Black Americans, white Americans.
Yeah.
That disparity, that gap was closing.
Wow.
Yeah, but I think in these last 2 years, I think we've gotten to see some setbacks.
Yeah. And is that, can we break that down a little? What are you worried about will cause even more setbacks?
I think the economic opportunities that people of color, other communities, diverse communities might not have good paying jobs,
Right.
and they might not be able to afford healthcare. A rise in discrimination, racial discrimination, ethnic discrimination, LGBTQ plus based discrimination, I think is going to contribute to these disparities. Especially when there are schools that are doing away with like diversity, equity, and inclusion in training medical doctors, in training medical staff.
Yeah.
And so they're doing away with that from their curriculum.
Yes.
So that's going to really impact these communities the most. And it's going to exacerbate some of those disparities that we've been trying to close. I think that if we continue to have exclusionary policies, that's going to definitely widen those gaps again for some of these groups as well.
Yeah, and another argument I've heard you make to your students, because your students are so inspired by the class, right? And I've heard many of them say, what can I do in the future to close these disparities? And you make this argument that you also need to understand those disparities. So I'm also thinking about the cuts in federal funding to basic scientific research and us not even having the basic tools to understand these disparities.
Yeah. When the federal government does away with LGBTQ or trans and non-binary people from websites. That's the start, right? And then pulling the funding away from institutions that from researchers that are doing these studies, these DEI studies, and these are reputable researchers that have had stable funding for quite some time. Just because they are researching something that the federal government sees as not as science that they want.
What would you and I know we're going off script. I hope you're okay with that. But
that's how I was like,
what might you say, or what could one, let me say it this way. What could one say to folks who are cutting research funding based on the following argument? We're just all humans. We all have the same body. We really don't need to study health from particular community perspectives. What might one argue is the reason that we need to look at community-specific health?
We do know, when speaking to communities, that their own traditions, their own values, their own beliefs influences their health behaviors. So them wanting to exercise, them wanting to drink, them wanting to take care of their health. So that's one of the things that I often tell folks who challenge and say, why should we do this? The second, I think, is culture is very strong in terms of influencing beliefs around health. So what do I think, based on my cultural beliefs, that caused this cancer? It might be, maybe an evil spirit. I carried an evil spirit and my time was due. Right. That is a common belief among some Latino groups, that evil spirits cause these physical health issues. And so we need to understand these beliefs underlying how one kind of sees as a cause for the disease. So you certainly want to understand that those psychological processes, because they do differ by communities. And I think the third one is we don't exist we don't exist in a vacuum, like kind of devoid of culture. All of us have a culture. Including white Americans. They have their own traditions, they have their own values. So those things also influence their health behaviors, right, in that particular, or those particular communities. And so we benefit from knowing these traditions and values and beliefs.
That makes total sense, right? Like if you want to give our health professionals as many tools as possible and prepare them for the multitude of people they are sitting in front of and are going to treat, and giving them a wide view of the different cultures and how people understand health. That makes a lot of sense to me.
Of course. And it's unfortunate, right, that they're pulling back some of these more cultural type of courses in some curricula across the country. Because these are the foundational courses that students take to be able to understand someone else's experience.
You're teaching, you are developing, like here at Cal State Fullerton, though, we continue to develop these courses, and you've really been at the forefront of that. So thank you so much for that.
I'm excited. It gets me excited whenever I get that opportunity. The Psych 476 class is the one you're talking about, the racial ethnic health psych course. It's really cool because students get to actually look at the literature and see how their community is painted or portrayed in that. It's wild. For the longest of time, people of color and other diverse communities have been painted from like a deficits perspective. Like you have risk, you have risk, you have risk.
Yeah.
And more recent research is now acknowledging the fact that we have also resilience factors, that there are positive things about who we are and what traditions we hold and our beliefs in terms of promoting our health.
Yeah. Let's hear more about that, because I think you're right. Even the way that I've framed these questions are about like, oh my gosh, how are we being beaten down? How are we feeling stressed? Let's transition to the tools that folks do have to help them through these moments.
Of course. I think cultural pride is a big factor that comes up in terms of managing stress and discrimination too, experiences of discrimination. So having pride in one's culture, one's traditions is health protective. It actually helps individuals to be able to deal with instances of discrimination or any other challenges that they go through. I think connection to community, like family, chosen family, extended family, whatever variation of family, is also very, very helpful. Adherence to cultural traditions, right? Like in the Latino culture, we have familismo as a big one that focus on the family, and doing or making decisions about what we want to do in the context of how will this also help my family. Simpatía, being cordial with others, and having pleasant interactions, right? So adhering to these values really kind of helps us really ground ourselves in who we are, and that tends to be very health protective. Knowing who you are and what traditions you hold dearly is important.
You saying this reminds me of one of the statistics you shared with us earlier. Later you might do, but earlier, about how one of the things that can feel so harmful and stressful is when you feel like you're breaking from your family, or something that you're doing rends that. Right?
Yeah, no, it is hard. So I always tell my students when I'm teaching them in these classes that family is kind of like a double-edged sword. In some moments it can be very helpful, in some moments it can be harmful. And that changes too with the family system. But more so, for students who maybe come from parents who are immigrants or who immigrated here or migrated here, I always ask them to remember acculturation. So acculturating to a new society. That could be underlying a lot of the stress that they're experiencing. That also pushes second generation, the folks that are the offspring, to not adopt some of these traditions. So they may not have a connection to the roots, their cultural roots, because of assimilating into the dominant culture. So I always ask them to remember, let's make sure that we understand that this is the process that's happening here. And this is the thing that's tearing families apart. And when we look at the literature, to no surprise, second, third, fourth generation Latino, Latinx persons have worse health than the migrated Latino, Latinx persons in terms of their physical health. We call that the Latino paradox in the health literature.
I've never heard this.
Yeah.
Wait, so what are some of the explanations? Is it this concept of acculturation and
something about living in this society that is very pull yourself up by the bootstraps mentality, right? The myth of meritocracy, that's what we call it. That is, work all the time, capitalistic in that sense, really erodes our health. And so folks who migrate here at the beginning of their time here don't typically come from countries like that. As they become acculturated and buy into those values of the dominant culture, that's when their health starts to erode. But we really see it in their second, third generation, fourth generation offspring. And Texas is a good example of what Latino health is going to look like across the country, because they have second, third, fourth generation fifth generation Latinos there too.
Fascinating.
Yeah.
Huh. It reminds me, I mean, this is neither here nor there, maybe this will get cut, but you know, I was talking to some of my colleagues about you know, the famous economist Hayek, who's writing during the Great Depression, right? And he predicts that by the time we get to this moment or earlier, we will, because of our increasing productivity, we probably would be able to get away with only working 4 hours a day and still have the same quality of life. But we haven't gotten there. And one of the things that was posited by is like this New Yorker article that was looking back at this Hayek essay, is that it is so ingrained in the American psyche to never be satisfied with what you have. You always want more. You always want the new thing. And so allowing us the luxury of just rest and accepting what we have. Is something that I think is hard in the dominant culture.
I think so, and that's really taking its toll on not only Latinx persons, but people from other countries, Asian Americans who are here, folks from Middle Eastern North Africa that migrate here and their offspring. Children. So it's affecting a lot of immigrant communities in the subsequent generations. So I you brought up quality of life. I think it's an important thing to focus on, not just if people are going to die sooner,
right?
Mortality, that tends to be one statistic we look at, but how are they living in terms of living longer, right? And I call this effect that I kind of observed in the literature with Latinos in Texas, the living longer hypothesis, but also lingering with the health effects and the disability of living longer.
Yes. When we think about disparity, usually we're thinking about economic disparity. Are there other types of disparities that could impact health?
Definitely. So economic is one, I think. Educational disparities. So having differences in the level of education and access to those types of educational opportunities. That's another disparity. There's disparity in terms of housing where you live. And residential segregation has played a big role in that. I call it living, on the wrong side of the train tracks, where communities have been forced to live in a certain part of town. And often these places are dilapidated, they're outdated, they may have asbestos, they may have lead-based paint, all the things that we now don't see in newer complexes, right? But they may be forced to live in a housing situation that is different from, people that have better housing opportunities. It might look like disparities might look like in the healthcare system, like waiting more than usual for a doctor's appointment, or when you do have an interaction with a physician, the physician not prescribing you pain medication because they think that you can tolerate the pain better compared to other groups. It might look like the provider assuming things about you based on your ethnic group, based on your sexual orientation. I've said this in another podcast that I've done, so I feel comfortable sharing. When I went to access a medication for HIV, for the prevention of HIV called PrEP, the nursing staff said that they can't give me a referral to a PrEP provider because I don't have HIV. And I told her, wait, this is to prevent it. It's a prophylaxis. That's what it's called. Pre-exposure prophylaxis. It helps prevent it. So I felt like I needed to, play the role of a provider, right, in that context, because I was, given wrong information by the provider in my attempt to access it. So these barriers can be put up, right, based on an assumption here that I'm not HIV positive. So I can't access this medication when it's the other way around. It might look like not getting the surgery that I need in a timely manner, or not getting it at all. It might look like waiting longer in the ER. It might look like, and this happens, hospital diversions, where people of color tend to have higher rates of hospital diversions. So instead of going to, let's say, a nicer hospital, the person driving the ambulance takes them to a county hospital because of assumptions that they make.
Yeah.
And so there are higher rates of these ambulance diversions, hospital diversions
Mhm.
in communities of color than
Mhm.
there are in white American communities
Yeah.
that tend to be taken to these affluent hospitals that are mostly private for the most part.
Yeah.
So it might look like that. It might look like not being able to fill out medication in my local pharmacy because it's typically not available there, or it's only available in the richer parts of the county or in the city.
Mhm.
So it breaks down that way, these differences and how you're treated differently based on an assumption.
Yeah.
Yeah.
And I'm also thinking, tying this to the points you made about
Yeah.
acculturation, I think cultural assumptions are how we build systems to exclude some people from fitness areas,
Hmm.
right? So we have a Melon Latinx
Oh,
Lab
yeah.
program, which looks at storytelling in Latinx communities. And last year they had a symposium about like environmentalism and
Oh,
outdoor
yeah. Yeah.
recreation among Latino populations, right? And kind of demys or I think some of these spaces like hiking is sometimes looked at as like
Yeah.
a white European
Hmm.
based
Yeah.
activity, right? But I think there's also that like kind of the preventative stuff too,
Yeah,
right?
no, definitely, and I think that's kind of tailoring, these things that traditionally people do to be more inclusive of
Mm-hmm.
people that come from diverse backgrounds. When I teach the Psych 476 course, I talk about what physical activity looks like in different groups.
Mm-hmm.
It doesn't have to be, running in a park.
Mm-hmm.
It could be going to a Zumba class with, family members or friends, and
Mm-hmm.
you gather after, and you do chisme, you do gossip, right?
Yeah.
And so I show my students a class of what a Zumba class looks like
Yeah.
in community spaces.
Mm-hmm.
With Black African American communities, it might be taking a hip hop class, dance classes
Yeah.
as physical activity. It might be taking a jazz class.
Mm-hmm.
For American Indian communities, it might also be something more in the community. So, like in a community space, beating drums,
Mm-hmm.
right? That's also physical activity.
Right.
With Southeast Asian communities, it might be a Bollywood dance that's
Mm-hmm.
more inclusive of, seeing Bollywood movies, right?
Mm-hmm. Mm-hmm.
And so that might be physical activity that's more tailored to including one's culture, including one's traditions,
Mm-hmm.
and being more inclusive in that way.
Yeah.
Yeah.
I'd like to transition to your own trajectory to academia and get to know you as an academic.
Yeah.
So, how did you end up here? What was your route?
Yeah. So I completed a PhD in clinical health psychology.
Mm.
Just for context, I was always curious about healthcare. My parents always took me to the medical appointments because they couldn't speak in English, and
Yeah.
they didn't have as many interpreters back then when
Mhm.
I was growing up. And I would always be the interpreter. I would be brokering
Yes.
all the time in medical appointments.
Yeah.
But it really stood out to me when my mom was pregnant with her fourth kid. You know the power of changing healthcare. So
Mm.
she got gestational diabetes. She was
Okay.
diagnosed with that with my sister, and the power of changing nutrition not only impacted her, but it
Yeah.
impacted all of us in this
Oh.
family, in the family system. And so for me, that was an important thing to see how, the importance of the family and changing the family
Mhm.
together. Like
Mhm.
I went through that.
Yeah.
She changed her diet. We all changed our diet
Yeah.
because she was the one that was preparing our food.
Yes. Yes.
So of course we all had to change our diet, and it was for the better.
Yeah.
All of us, I think, were at risk for like diabetes.
Mhm.
We were definitely heavier, and
Mm.
um, that was a positive change. And so I got to see firsthand, like, this is the type of intervention that you need to do to be able to affect a large number of people,
Yeah.
right? Focus on families to change this behavior, this
Yeah.
nutrition. proper nutrition. And so I got very lucky that at Cal State Northridge, when I was doing my BA there, I met Dr. Luciana Lagana, who may rest in peace. She passed away a couple of years ago. But she was a health psychologist. And she showed me the world of health psychology.
Wow.
And I got to do research with her on her NIH-funded grant that she had collected on older women and their health.
Yeah.
Older women of color. And so I got really involved in that lab. I became like a lab manager at one point, and then I decided to apply for a PhD program after I took a year off.
Yeah.
And while looking for programs, I really was wanting to work with a Latinx psychologist because I definitely wanted that. I never had that mentorship ever. And I was able to land with a couple of folks in Texas. I got accepted at a couple of schools, and ultimately I had to go with my passion in health. And that's where I met Dr. John Reese.
Yeah.
He was my mentor and now my colleague.
Yeah.
And we've been publishing. He's included me very graciously in a lot of things in health psychology, introduced me to people that have really helped me throughout my career.
Yeah.
So connections have been very important. And this mentorship, right, that I got was very important.
Yeah. And I see you giving that back to your students.
I'm always about like pay it forward. Like, you want to pay it forward to the next generation. Because as I tell my students, like, I'm helping you all with the torch, because at one point I'm going to die, right? We're all headed there. To be morbid, but this is going to be also your work, your good work, and the good work of the next generation. Yeah.
What are your other goals as an educator?
You know, I have a lot of lofty goals, but in terms of educating psychology students or just students in general, because I've taught like medical students and all these other allied health students before, I want folks to walk away from taking my classes knowing that they can become leaders in addressing health disparities. That's what I'm trying to focus on in the Psych 476 class, and also in a health activism class that I am proposing. Intersectional health activism. And so not only that, but acknowledging that psychology is medicine. We're part of medicine. I was part of medicine when I did my clinical work in hospitals. So I worked alongside doctors. We are part of healthcare. And so I think it's important for students to know that coming out of my classes, and just any class in general. I think that I want students to walk away knowing that health disparities exist, that these differences are not just due to biology. That there are psychological and social factors too. Students get that perspective in my class, and oftentimes, you know, when we cover discrimination, they're like, wow, it's what I call an insidious factor here, because it really gets under the skin. And I think the last one is to appreciate diversity. Because I think we need to embrace it. We're just becoming that much more diverse in this country. So we got to embrace that instead of pushing back.
Wonderful. Do you feel like the medical profession accepts psychology as part of it, or is there work to be done there?
I think that there is a lot of work to be done first, but I will say that there are spaces in biomedical conferences and hospitals where psychology is actively embraced. The VA is very good at leading the charge with this. They include they have a chief of psychology on their leadership team. So I think there's work to be done still. Some places psychology is not seen as a valuable profession. And I think that's where we can actually show our value. There are studies that are coming out showing how psychologists actually improve the efficiency of medical hospitals and medical offices. And so it makes sense from a business perspective to add us to the medical team.
No, it's interesting. Sometimes when I'm in health spaces, I play a game and I'm like, okay, I'm going to guess who came up through like humanities and social sciences. And I will ask like people I'm around, I'm like, oh, what's your educational background? And I do find that the people who seem the most holistic in thinking about health, like they have something that came from the social sciences or humanities in their background that seems to let them take proper care of folks.
Yeah, and I think, our college does a really good job at having these courses in health throughout all of the programs.
Yeah.
Really, I'm really impressed by that.
Yeah.
When I was creating the psychology track, the health and well-being track,
Yeah.
I really got to see that. And I'm like, wow, even Chicano Studies has a health course too. Yeah.
Yes.
And so I was very pleasantly surprised, and I loved it.
Yeah. What are your hopes for you said that we've laid out what you've already done, right? You have already, while you've been at Fullerton, really launched this health disparities curriculum. You also mentioned a health activism course. What do you have in store for our students here?
So the health activism class is that class where I see us taking more of a what can we do now.
Yeah.
So the other health disparities course is more so like pointing at the problem, and this is fixing the problem. The other courses.
Yeah.
So I like that sequence that students can follow, and then they become more kind of equipped of, okay, do I want to take the next step of going to public health or medicine or physical therapy, as a physical therapist, occupational therapist, speech therapist, physician assistant, all these health practice or health professions that typically psychology students don't really think about.
Yeah.
I see myself really bringing that here. In terms of other classes, I've also developed the Latinx psychology class. And we have two great faculty in our department for teaching that class. And students love it. I always check in with them and ask them about how it's going. And I'll be teaching it in the winter, so I'm excited for that.
Yes.
And hopefully in maybe a year or two, I can use my own textbook. So I'll be co-authoring a textbook on Latinx psychology.
Yeah.
It'll be the first actual textbook that is actually a textbook, not a handbook or anything like that. And so I'm very excited for bringing that into courses here at Fullerton, Cal State Fullerton.
I wanted to introduce this book you edited and wrote portions of, right? Heart, Brain, and Mental Health Disparities for LGBTQ People of Color. Can you tell us a little bit about it?
Yeah. This is my first edited book. I really saw the need in the scientific community to be comprehensive in how we approach health disparities in these three specific kind of areas: the heart, the brain, and mental health, particularly for LGBTQ people of color. The literature has been very fragmented, meaning that research has been mostly LGBTQ focused or people of color focused, but not, inclusive of LGBTQ people of color. And so this edited book really highlights that there are some studies that are inclusive, but we need more studies in these domains. And it also highlights that we need to really be consistent with what we're centering, who we're centering in the scientific literature. Is it mostly lesbian, gay, bisexual people, or is it inclusive of trans, non-binary, queer plus folks, right? Because most studies are not inclusive of those communities. Which racial ethnic groups are we representing in studies as well? And are we talking about discrimination, intersectional discrimination specifically? Because that's a big driver of disparities for these communities.
We're so lucky and grateful to have you here at Fullerton. And thank you so much for helping us make it make sense here on Low Key Confused.